My name is Dr. Jason West, and I'd like to share with you some really neat things to help you with tendonitis that will literally rocket ship your healing. It's treatments and breakthroughs that most doctors don't know about, and I'm excited to share with you how to really do advanced healing for tendonitis. It's such an irritating, painful, and annoying thing, usually because it's a repetitive stress injury, either from work or from your hobbies. And what I found is that it really bothers people's quality of life. So let me share with you what we can do to help tendonitis. So there's the wrong way, there's the slow way, and there's the best way. So let's talk a little bit about what tendonitis does and how you experience it with it. It's an inflammation of a thick cord of muscles that attach to the bone, and we call these tendons. And this condition causes tenderness, and it can occur in any tendon. So we're going to be talking specifically about tennis elbow, but it can be golfer's elbow, patellar tendonitis, Achilles tendonitis, bicipital tendonitis, literally wherever there's a tendon. And the most common areas are the shoulders, the elbows, the wrists, the knees, and the heels. And so what does it feel like? Initially you can have pain in this area. It can be burning. A lot of times it'll get worse. And if you continue the activity that caused the condition, it may spread down into your foot. If it's in your Achilles, it can be down into your knees or your shin. In the elbow, it may even come down into your wrist. And so a classic sign of this is the pain that persists when you place your arm and hands down on the table and tries to raise your hand against resistance. Another consideration is when you go to rotate, if you give a little resistance, you'll feel a lot of pain right here, or on the inside. You can go into extension and push, and it just doesn't feel very well. And so how you diagnose it is it's a medical history. You'll do an examination, sometimes x-rays depending on the area. If it's severe, you could do an MRI. You can also test the muscles doing an EMG if it's severe. But what is caused by repetitive stress, improper biomechanics, the wrong equipment, it could be a racket, it could be the equipment that you have at work, it could be wrong shoes, it could be the wrong throwing motion. There's so many different things that you can do. But the biggest thing that I've seen, and the thing that helps most with the healing, is it's a sign of malnutrition. Now, a lot of times people will say at this state, look, I'm not hungry. It's not that you're not getting enough of food. It's that you're not getting the right micronutrients. We're going to specifically talk about bioflavonoids, what they call vitamin P, which most people are saying, I haven't heard of it, but there's some vitamins that are really important for tendonitis. But there's also some minerals that, again, will absolutely rocket ship your healing, and that's what I wanted to share with you. So it's tendonitis is a sign of imbalance. The cells are weak. The muscles are stronger than the bone attachment. And so literally you have this sensitive membrane that goes around each bone called the periosteum. And as the tendon attaches that we call that an enthesis. If the muscle's stronger than the bone, it pulls it away, and it's literally like a fracture. And obviously fractures hurt, and tendonitis is no different. The bone becomes inflamed. So some of the common managements are, rest and stopping the activity that produces the symptoms, ice packs to reduce inflammation, strengthening and stretching exercises. I think those are great. The anti-inflammatory recommendations that many doctors tell people, I think, is actually a detriment or prevents healing. Now, if those things don't really work, the more advanced protocols or recommendations are bracing, steroid injections, which I'm going to touch on briefly in just a minute, an ultrasound, which I'm a big fan of, and surgery if it's the course of last resort. So some common sense preventions for these, keeping your arms or your ankles or your shoulders flexible, avoiding repetitive movements. It's easier said than done, but yes, if there's a bad motion that you're doing, you want to avoid that. You want to warm up before exercising, using and stretching those joints. I think that's a great thing. And if you play a racket sport, make sure the equipment is right for you. Now, the key points in doing this in tendonitis, warming up helps, good equipment, exercise, and physical therapy, I'm all for it. But man, it's such a slow way to heal. What if we could get you to heal a lot faster? And so let's talk about some treatments that not a lot of healthcare providers know about. So when we talk about healing, it really breaks down to these areas. We want to fix the cells. If your cells are healthy, then we can make healthier organs, tissues, and muscles and tendons. We can take the waste products away from the area to the liver and kidneys to get out of the body. We want to identify the imbalance and bring cutting edge treatments to the area to make it heal faster. So things that prevent healing. So if you want to slow things down, and a lot of times this is unintentionally, but let's just talk about what they are. An inflammatory diet, which typically is this really addictive but good tasting thing called sugar. Non-steroidal anti-inflammatories, we're going to talk about that. We're also going to talk about why steroids actually slow down or prolong healing, and then some accidental side effects for prescriptive medications. Now, I have to say this because I see this all of the time. Those little things that you have in your medicine cabinet or in your kitchen, the non-steroidal anti-inflammatories, aspirin, ibuprofen, Tylenol, or Aleve, they're not exactly benign, and it's so important to recognize what potential problems that you can have from it. Indigestion, stomach aches, feeling sickness, diarrhea, stomach ulcers and bleeding, headaches, drowsiness, dizziness, and allergic reactions. One of the most common reasons for hospitalizations, accidental side effects, is non-steroidal anti-inflammatories. And look, no one wants to live in pain. Like, I've had kidney stones, I've had broken bones. I don't want to live in pain either, but those medicines are designed for short-term emergency or crises, not a long time. And there is some significant problems that you could face if you're not aware or if you're taking too many. Okay, the other thing I want to talk about is cortisone and prednisone. There's a lot of medical literature that cortisone injections and taking prednisone can have some unwanted side effects that prevent healing. It can also have some accidental side effects: skin thinning, loss of color in the skin, intense pain, facial flushing, insomnia, and high blood sugar. And when we start getting into the medical literature in the European Journal of Endocrinology, we have the suppression of adrenal function by glucocorticosteroids is a common, potentially dangerous, and unpredictable. We also at the Mayo Clinic, long-term steroids increase risk factor for weak bones, which is part of the problem anyway. And then also MedSafe reported that low-dose steroids can increase the risk of fractures. Now, the reason why a lot of providers use cortisone injections is because it literally blocks all the pain in the area, but it's not healing anything. So to talk about rapid recovery, let me show you this. One thing you want to do, you want to line up the biomechanics of the muscle and the tendon and the joint. We want to make sure all the biochemistry in place. I want you to be aware of something called body welding, which sounds horrific, like it's not literally welding, but it's putting things into the area that literally helps that enthesis or the attachment of the tendon into the bone to really lock down. There's some regenerative medicine, and there's some protein organization that literally can speed up the healing from days, literally from months to days. So the advanced and rapid onset and recovery of how to help tendonitis. Biomechanics, ultrasound, and what we call cold laser, which stimulates the energy uptake and the ATP formation. We're going to talk about advanced nutrition, regenerative injections, advanced protein organization, which is really a big game changer. This is where you can take athletes that are and weekend warriors that are saying, look, I can't really function, and rocket ship healing. And then also there's a way to help bypass stomachs if people are having irritable bowel syndrome and malabsorption syndrome. So let's just talk about some of the most important things we can do for tendonitis. Number one, you need to know about this mineral called manganese. Now, if I go over to the literature, I'm going to show you that manganese is essential for helping ligaments to be strong. And then there's this wonderful medicine that it's my favorite thing called vitamin C. Everybody's heard about vitamin C, but there's something that helps vitamin C work. It's a cofactor, and the old school terminology for it is called vitamin P, or what we call rutin factor. And we're going to talk about that. It comes from beet leaf greens and really colorful fruits and vegetables. Then there's a protomorphogen, which is a nutritional component where you can take literally a DNA blueprint. It tells your body how to heal and then how to organize proteins. So just a real quick review on manganese. Manganese is a mineral, frequently gets confused with magnesium, but it supports connective tissue and provides benefits for ligaments, tendons, joints, and muscles. It also helps to get poisons out of your system by being an essential component of an enzyme called superoxide dismutase. What this does is it protects the cell membranes from oxidative damage, and it helps to get poisons and waste products from the injured area out of your system. They take it over to the liver and the kidneys, and it's literally either out through the bowel movements or through the kidneys. Now, something really, really fun that's a breakthrough is something called protomorphogen therapy. This is a nutritional therapy, a cell determinant that comes from an organ or glandular tissue. Literally, it's ground up cow tendons, and it's a smallest unit of the chromosome, which allows the blueprint and framework which the cell was constructed. So it acts like a seed of a plant by helping the normal tissue function and catalyzing cellular repair. This is something we've been using in our office. I mean, I'm in a generational office since the 1930s. I have personal experience over the last 23 years, and protomorphogen therapy for ligament and tendon therapy is a game changer. The other thing that's so important in cellular repair is doing something called peptide therapy. Now, what peptides are is they organize amino acids into proteins. So sometimes these peptides stimulate growth hormones, sometimes they help with growth hormone releasing peptides, and they're designed to do a whole bunch of different functions in the body. Sometimes it's weight loss, but specifically the peptides we're using is for the reduction of joint and muscle pain. So here's an example of just some of the things that peptides do. It boosts energy, it enhances physical performance, it can improve weight loss or weight gain, depending on which peptide you do, improves appearance, enhances sleep, builds muscle, burns fat, repairs muscles and tendons, can increase sex drive, and sharpens memory and cognitive function. So when we start talking about healing, again, we're coming back to this simple plan: biomechanics, ultrasound, which is like a cellular massage. We can use a laser light therapy to uptake energy, advanced nutrition, protomorphogen, and peptides. So how we can help people literally is this. We have an out-of-the-office nutrition prac. If you're across the country, we can do a protocol design. I know doctors literally in every state where we can refer, and then we can start plugging in some of these advanced treatments. Now, a lot of times, if you just get people taking manganese and protomorphogen and peptide therapy and vitamin P, also known as rutin factor, and some bioflavonoids, what happens is all of a sudden now the body has the ability to heal itself. For advanced cases where we really want to, and we're on a timeline, or people saying, look, I just got to get back on the pickleball court. I got to get back on the tennis court. I got to get back running every day. We have the ability to do some regenerative injection therapy where you're taking vitamin C and B12 and a really mild sugar solution that feeds the cells and vitamin building blocks, and we're injecting that specifically in the area. And this is where, if you've seen our YouTube channel or you've seen our Facebook Live channel, you'll see we're constantly showing the medical success stories that we have, the medical miracles, and this is part of that process where we're really able to accelerate the healing. Now, sometimes people are sick because they have a bad stomach, and how we can help to get the nutritional therapies inside of the area and really help with energy is to do a vitamin infusion therapy. So I have a bag up here where you're literally seeing vitamins and minerals and everything inside of the IV bag. We put it right into the vein. We skip the stomach, and what happens is now we're able to really help getting additional payload to the bloodstream. Everywhere blood goes to, that's where we go to. So we can do advanced healing parameters and heal in days, not weeks or months. So here's the next step. We want to help you with getting the clean eating guide, the healing nutrition packs. Be aware of the advanced in-office treatments. If we need to do protocol designs or provider referrals. And here's where you get information. If you'd like to engage with us further and get our free ebook and know about the specifics for our nutritional packs, go to whatifdoctorsfixpeople.com. There's a little form that you fill in that we're going to be able to send you the write-up and the specific nutritional recommendations for ligament therapy. For immediate assistance, if you got to get going right away, you can email us at info@westcliniconline, or you can call us at the 208-232-3216. So just a recap on tendonitis. It's an overuse injury. There's a significant nutritional deficiency component. There's really fast healing that's available, and all you have to do is go here to What If Doctors Fix People. There's tremendous value in our ebook. There's a way you can engage with us literally immediately. So that is a real quick overview of what we can do for tendonitis, for ligament injury, for things that can really rocket ship and help your healing. Remember, you're not your diagnosis. And if we treat the person and balance out the deficiencies, then we get really, really nice healing responses. I'm Dr. Jason West. You can see us on our Facebook Live, our YouTube Live. I do a national radio show every Friday called America's Healer on Voice America, on iTunes, on Google Talk, iHeartRadio, Spotify, and Pandora. I'm in private practice in a little railroad town in Pocatello, Idaho, and my mission is to reach, teach, and help heal the world. I'll see you guys on our next video.